Hi, Dr. Toro. My name is Whitney, and in this presentation, I will be discussing applications of the Healthy Work Environment Standards, or the HWE, at DaVita. A healthy work environment in healthcare is crucial because it directly impacts employee well-being, reduces burnout, and fosters collaboration, ultimately leading to better outcomes for both staff and patients. This presentation will discuss strategies that may achieve a healthier work environment. According to the American Association of Colleges of Nursing, research shows that units following the HWE standards have better staffing retention and lower workplace distress, thus enabling nurses to provide compassionate care. And ultimately, you want nurses who are well taken care of so that they can do their best to care for their patients. The AACN developed the HWE standards as a framework to foster supportive, safe, and effective clinical environments for healthcare professionals. These standards are built on the belief that a healthy work environment is fundamental not only for nurse retention and job satisfaction, but also for patient safety and care quality. Listed here are the 6 healthy work environment standards. I won't read through all of the definitions, as you are probably going to hear this 100 times as you're grading this, but I will list them off. Their communication, collaboration, decision-making, adequate staffing, recognition, and leadership. Shown here are my survey findings. Relatively good scores across the board as they all rank above 4s, but the 3 lowest are highlighted in yellow. True collaboration, meaningful recognition, and authentic leadership. The next slides will discuss these issues further. True collaboration was ranked the lowest of the 6 categories. This is because nurses felt there were issues around role confusion and scope of practice. Also, teammates complained about time constraints and workloads, often preventing effective collaboration. Generally, there was also a lack of standardized tools in communication, so oftentimes communication was dependent on a teammate verbally communicating necessary details to other teammates. Some strategies for improving true collaboration. Survey results show that NICU staff experience higher job satisfaction and improved collaboration after transitioning to a decentralized unit. A unit can also implement structured communication protocols, such as daily huddles or handoff meetings, to facilitate clear, consistent, and continuous communication among all team members. This ensures that everyone is on the same page regarding patient status and treatment plans. Provide open access to structured forums, such as ethics committees, and allocate the necessary time and resources to resolve conflicts among all key participants, including patients, families, and the healthcare team. As the APN in this facility, I would work with clinic leaders to make sure there are regular opportunities for the team to meet and discuss patient care. This would increase face time. I would also encourage everyone to see these meetings as a helpful way to improve care and not as a sign of failure. And I think that by making the frequency of these meetings consistent, it could take away any negative connotation to have these discussions. I'd also organize team discussions with nurses, doctors, social workers, and dietitians to talk about tough cases and find solutions, making sure teamwork is a continuous part of our process. Of the subcategories under meaningful recognition, the recognition taking place between RNs and top-level leadership was ranked most poorly. This made sense to me because there can be a disconnect between top-level leadership, as there is minimal face time necessary, and these executives often have different KPIs that keep them at a distance from the frontline team. Secondly, although it wasn't as much of an issue with top-level leadership, recognition taking place between RNs and nurse managers was only rated fair. Some strategies for improvement. There's a study where Hollywood Wall of Fame was created. It's a gratitude wall that celebrated nurses' achievements, years of service, and meaningful contributions. The team would decorate hallways, break rooms, and walls to energize the unit, and the initiatives inspired other departments and traveling nurses to replicate the idea. There's also the Wheel of Recognition strategy, which is aimed to reduce nurse turnover and improve workplace morale. This is done by holding events twice a month where staff get to enjoy warm breakfasts, prizes, and a chance to relax and connect. This obviously takes money, and so there are grants that can help with the cost of these events. But the brief event includes a fun spin the wheel game where staff members win prizes and receive personalized recognition for their contributions. This approach can foster teamwork, joy, and a positive work environment. As an APN, I would implement recognition strategies like the Wheel of Recognition to boost staff morale by regularly acknowledging contributions and fostering a positive, supportive environment. I would also implement a process to facilitate the nomination of team members for recognition at local, regional, and national levels to acknowledge and celebrate their contributions so that top-level leaders can be involved and show support as suggested in the AACN. I would organize team events and ensure that all healthcare roles are included, so this encourages collaboration. Additionally, I would advocate for small incentives and social opportunities to create a cohesive and engaged team. Finally, authentic leadership was ranked third lowest in the survey. There are two parts to this where there are authentic leadership issues around the top level leaders, but also around the nurse managers who work in the clinic as well. Now, this could happen because of inconsistent behavior. This one's a little bit more specific to the top level leadership, as authentic leadership requires consistency between a leader's actions, values, and words. So when a leader talks about doing what is right for the patient, but only puts resources where there is the most profit, that inconsistency undermines trust, causes confusion, and creates an environment where staff feel disconnected, and unsupported. This could also be because of, on the nurse manager side, this could also be because of limited support for development. While authentic leadership emphasizes fostering open communication and personal growth, some nurse managers may not effectively be able to support professional development with their teams, or may fail to provide constructive feedback in a way that enhances growth for various reasons, such as time constraints or lack of resources. When you're a nurse manager running a clinic, doing administrative stuff, and also being on the floor, time can be a big issue. To mitigate this, these were my strategies for improvement. Self-awareness is a key trait of authentic leaders, involving an understanding of their team strengths and weaknesses, and using reflection to improve their leadership. For the nurse manager, the organization can also offer support and access to education or coaching to help nurse leaders develop and strengthen their skills in authentic leadership. As an APN dealing with executives who exhibit inconsistent behavior, I could approach the director privately and discuss the observed behavior. I would use I statements to avoid sounding accusatory. So something like, I've noticed that some of the team feel unsure about, and then talk about the specific behavior, and it seems to be causing confusion. This would help bring, first, awareness to the director, and then secondly, give them a chance to address it. This also encourages open communication. Encourage the director to clarify their decisions or behaviors with the team, and foster an environment where open communication is welcomed. Finally, for the nurse managers, encourage them to offer regular constructive feedback with their team. This could be in the form of conducting regular one-on-one meetings to provide constructive feedback on performance. This helps nurses understand their strengths and areas for improvement. Like you, Dr. Toro, I ranked highest in the pioneer category. Some of the characteristics of a pioneer are forward-thinking, embracing innovation, and inspiring teams by communicating a bold, future-oriented vision while exploring new opportunities and ideas. Pioneers also push boundaries, embracing uncertainty as an opportunity, and encourage teams to step out of their comfort zones. Pioneers are typically charismatic. They excel at motivating teams by instilling excitement and purpose about the future. Ways that this could help with the previous identified problems. Innovation and visionary thinking can enhance true collaboration among nurses by inspiring creative problem solving and encouraging new ideas. Pioneer leaders can also promote meaningful recognition for nurses by encouraging innovation in others and celebrating their risk-taking and acknowledging their contributions. A pioneer leader can help mitigate nurses from feeling their directors are not authentic leaders by promoting that openness and that clear communication discussed earlier, which fosters trust and transparency, making them feel more engaged and valued. I would implement to some extent the 8 steps of the change process as listed in our textbook for each of these problems. This would require developing a task force, creating a team vision, identifying and analyzing forces of change, develop a work plan for the changes, then implement the change, and evaluating the outcomes, and then refine as needed. In conclusion, I'd like to highlight these key points. Adopting the AACN's Healthy Work Environment Standards is really important for improving nurse retention, job satisfaction, and patient care. One key way to address leadership issues and support professional growth through a pioneer leadership lens is to encourage innovation, open communication, and recognition. I'd focus on strategies like better communication protocols and developing recognition programs to make the work environment more structured around a positive experience. By aligning with the HWE standards, we can create a workplace where nurses feel valued and supported, which ultimately boosts morale and overall quality of the care for the patients. My call to action as an APN with a pioneer leadership style is to, of course, adopt the AACN HWE standards at my facility. Then using this, my team could create and implement the changes utilizing the 8-step change model to create communication protocols, ethic discussions, and recognition programs. Thank you for your attention. And if you've never used Canva, this was my first time using Canva for a presentation. It has been really great and visually just a lot more appealing than plain old PowerPoint. Thank you. Thank you for your attention. And if you've never used Canva, this was my first time using Canva for a presentation. It has been really great and visually just a lot more appealing than plain old PowerPoint. Thank you.